because they have to really look deep into the ear beyond the eardrum. But if they didn't say anything about if the eardrum was still intact or if it was perhaps ruptured or perforated, here's the problem. When you do an ear flush in that eardrum state, when the eardrum is already disrupted or perforated, we risk that fluid to hit beyond the structure inside, and it could hit a vestibular nerve, perhaps. Almost, we could say it caused it, but we don't really know. But it's an assumption because of the series of events that you described. It's also possible that maybe without the flush, it's possible because of the vaccination, scenario and going to the vet, maybe it elevated the stress exactly. And if he, perhaps this was echiniculi, if he was already a carrier, it just manifested the disease of echiniculi because of the stress event. That's possible. But the fact that you told me that he started with a suspected diagnosis of ear infection 1 month ago, it's very possible that, one, we are dealing still with an ear infection, and now it's progressed from the middle ear to the inner ear, okay? Even with the 1 month of antibiotic, which was only 1 month of one type of antibiotic, which only covers a subset of bacteria strains, what if there are strains that exist that are still proliferating beyond what Septrin would cover, right? So it wouldn't matter if you gave it for 3 months because actually you want to give long courses, right? It may not work for part of that infection, right? Not to mention the inflammation component. You did not get Metacam a month ago, did you? Exactly. So there is an inflammation component here that was not addressed from 1 month ago, right? And then what could happen also is maybe if he was an echiniculi carrier, the persistence of the ear infection could also awaken it because the immune system is now suppressing. So see how it's kind of all connected. It's like, it's just a number of possibilities and scenarios that could contribute to what we're seeing today as a clinical symptoms, the set of clinical symptoms.